Hi, I'm Sandra Versalano, and today I am interviewing Sheyla Pierre, Director of Equity Development and Community Engagement for the Genesis Project for Roseman University. This interview will consist of Sheyla sharing what this project is and how this project came about and why this project is important. Okay, I wanted to make sure you guys saw me before I put her on. My website theme is community support and engagement for the aging community. However, Sheyla's community involvement includes all ages. So without further ado, here is Sheyla Pierre.
Thank you so much, Sandra. I really appreciate the opportunity to be on your platform to talk about all things Genesis. And so I'm excited to be here. So oftentimes when people hear Genesis, they are asking me like, what is that about? Is it like home health? Is there some type of like religious connotation to it? And I'm excited to tell you the story about Genesis. To do that, I'll just have to go back a little bit by saying that I first started to get into the work that I'm going to explain about 10 and a half years ago. And that's higher education, working at a medical school. And so my background is in social work and business. I like to say that I'm at the intersection of like private and public sector, on social good, and that's the space that I love and that I champion. And so what I loved about this medical school that I was a part of 10 and a half years ago is that they had an emphasis on community, that they wanted to prepare future doctors with becoming the best physicians in terms of community engagement and social accountability. Now, we love our doctors and we want all of our doctors and any health professional to be engaged and to have good bedside manner and to understand that their patients are more than their conditions, that they have families and they have different factors that impact their health. Housing and food and transportation. And so in healthcare, these terms are referred to as the social determinants of health. And again, in healthcare, that is known as the social determinants of health, which are the different factors that impact your health outcome. The reason this definition is so important, or I should say the number associated with it, is because over 90% of health outcomes in America are related to the social factor. What that means is when it comes to how we will do in terms of like our healthcare, it's related to different things like our housing or our food or our access to healthcare. And so that is such a large percent of it. But often, more so in this country, we spend on that 10%, that clinical piece. So my work, right, all that to say, Genesis is about working with individuals and families to better their health outcomes. That is our role. And so just a little, again, going back to that story, started out in South Florida at another institution, Florida International University, at that College of Medicine. And so we were, working with medical students, nursing students, social work students. And what I loved about that approach is that the students got to understand how to work together, right? So for example, if you're a doctor, often, let's say you're in a hospital setting, when it comes to your nurse, your discharge, your nurse who's like the case manager or your social worker who's in discharge planning, you're figuring out that relationship in practice. I love that we take the approach of teaching students, these future professionals, how to interact with one another while they're in school, because then they know, okay, what questions to ask, or even what does a social worker do, or what does my nurse, do, or what should I say? How do we interact? And so the students really, there's a lot of different dynamics that happens when you do like that home visit piece. And so the students are required to do home visits for these households every quarter. So again, if we have someone enrolled in our program, they can expect to see a medical student or nursing student. At this university here in Las Vegas, we don't have a school of social work, but we will have community health workers who are able to support the social services. So that's kind of like what brought brought me to Las Vegas is that I started with the other medical school in South Florida 10.5 years ago. And about 7.5 years ago, the dean at the time, Dr. Joe Greer, Roseman was at this, looking for a dean for their new medical school. So there's that whole search across the country for a dean. And it just so happened that Dr. Greer had done a speaking engagement at Roseman a year prior. And so that's someone that they, was taking a look at. And so they had to thoroughly, do the dean search and like go through that process. And Dr. Greer was named as the founding dean of Roseman University College of Medicine. And so Dr. Greer brought out a team of senior executive deans to start the new medical school. And one of those deans is Dr. Luther Brewster, who's the senior executive dean for the Office of Community Health Innovation. And that's someone I had been working with the whole time I was in South Florida. He asked me to also come out and lead Genesis. And Genesis, we look at as, we think of, new beginning. And so we wanted to take the information that we had learned in South Florida in terms of like, this is how you improve health outcomes, and do the same thing here, but also consider Las Vegas, right? Because the same exact approach that we had in South Florida, we did have to tweak some things to better support residents of this state. And so so I got to Vegas in March of 2021, and Genesis launched in March of 2022. So we've launched this initiative 2 years ago, and so I'm proud to share that we have over 402 members in our program. So our program is steady. We're growing with our members, and so we provide support not just to one household member, but the entire household. So again, when you think Genesis, we are part of the medical school. And so we are the vehicle in which the medical students will engage with the community. And so they'll engage with the community through doing different service learning projects in the community. But the big piece is that every quarter, every 3 months, the student teams, which again is medical, nursing, pharmacy, they're going to do home visits for these medically underserved communities. And so you may be wondering, okay, what is medically underserved? And so that's based on information from Southern Nevada Health District and our public hospital, University Medical Center, UMC, where certain areas are deemed medically underserved based on different metrics like educational attainment, socioeconomic tickers as well. And so we at Genesis, we are working with high need population. So the way that I look at it is we're working with individuals or families where if Genesis wasn't here, there is nowhere else to go, right?
Can I interject a question?
Sure, of course.
Part of my beat of my part of the beat of my website is the aging community. And I just found it really interesting that your project kind of it partly centers on the aging community, because that is definitely one of the underserved communities areas. And that said, we are getting better with the pharmaceutical area of medicine for the aging and stuff like that. We're progressing in research and development and all that. But one of the areas that I focused on during my master's program was the community support and the engagement. Because a lot of times loneliness and not understanding, not having somebody there to educate you a little further, or just be there, be supportive for this transition that you're going through, is one of the hardest parts. And me transitioning into retirement and the aging population, I just thought it would be a great area to help and to let people know that they're not on this journey alone. And I think that Genesis can and will answer a lot of that, even if they're not aging, but the medical part of it, that community support, that help that you need is there.
I love that you said that. Thank you so much for adding that, because it is a huge piece. When we think about like our senior population, a lot of what we're seeing in Genesis and and throughout other programs is social isolation. And so that really started for us when we started to do meal deliveries, because before Genesis actually launched 2 years ago, we wanted to make sure that we were engaging with the community. A big part of the work that we're doing is centered on trust. So you heard me saying earlier that the students will have to do home visits. In order for them to do that, you have to have household members who are saying yes. You have to have community partners who are saying yes to refer their patients and their clients and their parishioners to us. So we were doing meal deliveries, and I remember, like, just if it was yesterday, going into homes of seniors, and they were just saying they hadn't seen anyone in days, and not just kind of like having that interaction. And so fast forward today, we have our senior pep-ups, right? Where we go out to different senior households or communities, and we do just different cognitive activities for our seniors to provide that support. Because on the medical side, social isolation does have significant health impacts. Some of those impacts are related to mental health. So our seniors are at risk for depression, anxiety, and loneliness. Another area of health that social isolation impacts is cognitive decline. So that's why we do those activities, so that there's some engagement, so that we're we're not looking at any progression related to diseases such as like dementia or Alzheimer's. Sometimes with social isolation, there's a decline in terms of like physical health because people aren't outside as much or just getting that, as much movement. And so that's why social isolation is so important. And so through Genesis, we have, again, all ages, but we do have a good number of seniors that are enrolled in our program, and we're helping them with anything from connection or referrals to Meals on Wheels services, but also a big one we see is personal care assistance. How can I get some of that help at home with like some daily living things? And some of the other things we're helping our seniors with are referrals to like specialty care services, different things like that. And so that's huge, right? So making sure that aging population, and if I just have to add, that's really like one of my top things to do, right? Our team, we have community health workers, community navigators, managers, and different things. And we all have those populations that are passionate to us. So whether it's our veteran community, seniors, those who may have a disability, but I think we all can agree, we just love our seniors. So we love to provide support where they need us and to also do the activities that you mentioned.
That is so awesome. Now, what I want to just put out there is my, I mean, I think the program is excellent. It's exciting in one area because when I started this, started the beat on my website, I wanted to make sure that, that this community had resources and access to resources, and to find out there is such a group out there is, I mean, I'm excited about it as well. I will, add all of your information to the website and at the end of the video, and to make sure that, people can just call and talk to somebody, and we go from there. Genesis sounds like a great project, and I know that it will grow. So are you looking, is there, now what I want to get this question right.
Sure.
What I put on my website is that the project is going to be in full force next year. Do you guys have like a specific day or month or?
Sure, we do.
Okay.
That's a great question. And so July 21st, 2025 is the day, and I will be able to confirm that February of 2025, and I'll tell you why. So with Genesis, as I mentioned, we're at Roseman University of Health Science, which is a private health institution, higher ed here in Southern Nevada. Roseman has been here since 1999. And so we have 3 campuses. one in Summerlin, that's where the medical school is going to be. We also have Henderson, that's where the pharmacy school and nursing school is. And then South Jordan, Utah is where the dental school is. And
Wow.
so just want to make it super clear that the medical school is not open yet. We're going through the accreditation process, which for a medical school takes a couple of years, but the first group got here in 2020. So we are 4 years in. And so when we open next year, I'm saying when we open, because we will, right? We're hopeful. It would be 5 years. And sometimes people ask us, oh, you all have you've been in the community a lot long and the school isn't open. Well, that's because we are community dependent. The community is our partners. And so we're going to need households to support us by allowing students. And that can't just happen when the school opens. So we spent 4 or 5 years in advance before the school opened, building that connection with the community. So we are in the process of accreditation. We actually just had our site visit with the LCME, which is the Liaison Committee of Medical Education. That's the accreditation authority in the US and Canada. And so they came to Las Vegas from Washington, DC to visit the school to make sure that we are ready to go. And so we got really good positive impact, and we get our big news in February. I do want to take a moment to thank, there were so many people from the state, from, capital to local community, health systems here, other medical schools like UNLV and Toro that has supported Roseman, because we all recognize that healthcare is such a big need in our state. And we know the numbers, how short we are in terms of like providers. We are like a little under 2,500 short of physicians. We have that shortage. And so Roseman starting this medical school is a step in the right direction in terms of increasing access to healthcare in this state, and that is what we need. And so we're excited about that in terms of the Genesis side. And so although we're waiting for the school to open, we are in full force Genesis in terms of like our services. So again, we provide support to members in the community if they need help finding a job, if they need help accessing healthcare, if they need help finding a job. We do all of this. And so our approach is to assign them a community navigator or community health worker that, by the way, we hire from the community. That's actually our investment back to the community, is that, we want to hire people from these neighborhoods that we're serving, because truthfully, they know about the pain points of that neighborhood. They have a better idea about the people who make up that community. I'm a product of that in South Florida, that hiring model. And so that's something we wanted to carry over, and we have to invest back in our community. And so that's what we do. And so, yeah, we're excited for July 21st, 2025 to welcome 60 medical students to Roseman University College of Medicine.
That is absolutely, it's awesome. And I'm excited to be a part of that, because I will definitely replay this, put this video on my site, and definitely, boost it and everything, because this is what I'm advocating: community support, community engagement, community involvement, because we can't do it without each other. That's basically the bottom line. So I want to thank you for coming on, and I want to thank you for sharing. And you are so, what's the word I want today? You were very informative. I mean, you gave great information. And like I said, we're going to put all of the things on the back end of the interview so others can get in contact with you. And we go from here, girl. Together we move.
I love it. Together we move. Thank you so much for having me and all that you're doing for your community, for our community. We need voices like yourself, and we need platforms like this. So thank you for all that you're doing, and I appreciate your time.
You're welcome. More than welcome. Okay.
Thank you.